About your proficiency in resuscitation skills.
Oh, I just thought it would be good training.
Liz, do you want to discuss anything with me?
No.
Okay. Liz, we already have one house officer facing a manslaughter charge because he didn't ask for help. I am not going to let history repeat itself.
Thank you, Dr. Hudson.
I wondered how Liz is doing.
Generally fine. Excuse me.
Claire. As registrar, I would expect you to take responsibility for teaching. I'd like you to keep an eye on Liz and set her straight if need be.
I'd rather not.
Explain.
She's ill-motivated, inattentive and manipulative.
I am not comfortable with that amount of personal contempt between two members of my team. At least Andrew managed to sit on the fence.
Andrew sits on the fence because he enjoys the sensation.
I think I'd like you to be a bit more professional in this matter, Claire. Please don't let it be something over which you and I fall out.
Mr. Tennant, I believe you and I have reason to confer.
Any sign of Raj yet?
Is he not here yet?
I knew it, our star player. Off with his girly again.
It's Reg here, mate. Not seen him. Hey, are you friends of his?
He asked us to come along to make the numbers up.
You're from his cricket club, yeah?
Yeah.
These are the ringers we've got to bolster our team.
Ah, we need that. We're crap. Yeah, I'm Baz.
James.
All right, mate. Andrew.
In case anyone asks, you're doctors, right? Dr. Smith and Dr. Patel.
What if that's
Just tell them you're locums from Casualty. No one will know you. No one will be surprised you don't know any medicine. Better turn up the girl's blouse.
My Little Pony.
The lady's handbag with her furry pink lining.
Dr. Kirkby. I think you and I should have a talk.
Nothing broken. The paediatrician can sort this out from now on. I should just be able to make...
Look, Raj, I don't know how long it'll be before Amanda gets back.
No, I want to spend my time off hearing the thud of leather on consultant, not a baby crying. All right, but just till Amanda gets back. With any luck, I should just be able to make the second innings.
He's not turning up, the two-faced git.
Well, James, should we make a start?
Try and stop us, Dr. T.
How would you like to call?
Heads.
Tails. Well, I think we'll bat.
Okay. Good luck.
We're bowling.
We're bowling.
Nothing broken on the X-ray.
Oh, that's good.
We wondered if you could give us some information on how this might have happened.
Well, I don't know. Neil?
No, I don't know.
We're not the police. We're not making any accusations. But if you can say if Hayley's had some kind of accident, then it might help us to find out why she's poorly. We're getting the paediatrician to have a look at Hayley, but she won't be here for at least another half an hour. Would you mind if we did some more X-rays in the meantime?
No, we just want you to do whatever's best for Hayley.
Yes, come on, Adrian, couple there.
What an advert for the public school system they are.
Oh, yes. Tutored in all major sports, you know. Not like the disorganised comprehensive school rabble like us.
Okay, let's talk.
Look, I can't keep this up any longer, Doctor. It was my fault that Hayley hurt her arm.
In what way was it your fault, Neil?
I gave Hayley a bath yesterday, and I'm clumsy with babies, and I let her slip onto the bath.
It's a minor injury. It will heal perfectly.
Look, I didn't think it was anything. You gotta believe me.
I do believe you, Neil.
Hayley's father walked out on Louise as soon as she got pregnant. I just want to be... Louise is the best girl I've ever been out with. No, I don't want her to think that I'm going to be a bad father for Hayley.
Okay, Neil. Does Hayley have any other injuries?
No.
No other injuries. Good. Any sign of Amanda?
She said she'd be down.
Okay, if I leave her to find out why the baby's unwell, I ought to get to the crease.
I suppose some might say you've earned it. I wouldn't.
There's something really wrong with her.
Raj.
Why won't she wake up?
Benzopenicillin, 300 milligrams, straight away, please, Patrick.
Right.
It's possible Hayley has meningitis. I can't say for certain, but the antibiotics will do her no harm if I'm wrong. Louise, will you help me hold Hayley's arm? I'm going to have to put a needle in.
Little veins take a lot of practice.
I think you're right to treat for meningitis.
I'm not having any joy here. I'm sorry, Hayley. No more bright light.
Temperature still 36.8.
No fever, no real neck stiffness.
She needs to go straight up to the unit. I'll arrange for a CT.
Dr. Hardy, come to school urgently.
Not again. I've got a really poorly 32 weeker. A little walnut with lines going in everywhere. It's not safe to leave this one.
I'll get a CT.
Thanks.
James, who is that lad?
Casualty locum, Dr. Turner.
What a rip. Well done. Visible. I shall return.
Hard lines, Graham.
Bad light.
Graham will insist there was some foul play.
Blade of grass out of place.
Fast.
Dr. Turner, Bull Patel for 26.
Ball tampering.
Yes, dear.
Not a happy baby.
Got the anaesthetist on standby.
Sorry.
Here we go.
Do you see what I see?
Yes.
Maybe I can get a look at her fundi now. Widespread retinal hemorrhaging. Pupils unreactive. I'll admit her to the unit and inform my consultant. You get off to your cricket, Raj. Thanks for everything. Better go and talk to the parents.
I want to come.
Sure.
Bowler's end.
Yes!
Dr. Patel's had his quota. If we're playing limited overs, should have another bowler.
Yeah, well, Raj is our other bowler.
Well, it's not our fault if your teammate can't be bothered to turn up.
I'll bowl.
Yeah! Well played, Claire.
Why can't I go with Louise to see Hayley?
I'd like to speak to you first, please. We have the results of the brain scan and the blood tests.
Is it meningitis?
No. What else did you do to Hayley, Neil?
I told you it was an accident.
There is bleeding at the back of Hayley's eyes. There are clots and hemorrhages inside her head. Hayley has severe brain damage, Neil.